All right. So we're gonna go ahead and start out with our events and activities updates. So if anybody has an event or activity they want to share, please do that now. I think Riley's on with us. So I wanted to give Riley an opportunity to share about an opportunity for a donation drive that he's got going on. So Riley, if you want to start us, go for it.
Hey, Jillian, and hey, everybody. My name is Riley Clifton. I live in Recovery Resources Housing, and I have been putting together a coat drive for the homeless and less fortunate around Kingsport. Um, it's a little short notice. I appreciate the opportunity to come on here and around. And just if anybody out there can lend some assistance with that, I would greatly appreciate it. And if there's anybody out there that has anything going on that I could be a part of, I'm more than willing. Public speaking opportunities or troubled youth, especially. And I am in recovery, so anything recovery related, I'm more than happy to help with that. Thank y'all.
Hey, Riley, this is
Yes, sir.
Randy Byington at ETSU. Do you work with Shades of Grace any in downtown?
No, sir. I've reached out. I reached out to Shades of Grace. I started going around the community, but I haven't heard anything back from them yet. No, sir.
Okay, thank you.
Yes, sir.
Anything else for Riley before we move on?
Thank y'all.
Thanks, Riley. Super proud of you and the way you're giving back to the community. Grateful that you're here. Anybody else have an activity or event they would like to share?
I'd like to share. I'm Caroline from Tennessee Voices Statewide Family Support Network, and I do want to let you all know that we're going to have some common sense parenting classes starting in January on the 13th in Spanish for all of those that have clients that speak Spanish and need parenting classes. Also, we're doing a Teen Connect Zoom class, and this is for parent, and they do have to, the only requirement, the classes are completely free, but the only requirement for the Teen Connect class that starts on December 6th through Zoom, and you can, if you are interested in that, please let me know. My email's on the chat. I can email you the referral so you can make the referral. But the only requirement is that they are DCS involved in order to be able to take the class for free. And this is to help families be able to communicate with their teens and to understand them according to the brain development and all of those great things. It's a really amazing class. And that's all I got.
Thank you, friend. Miss Caroline, would you put your information in the chat in case folks want to reach out to you? And then Riley, you've also got a request in the chat for your contact information as well. All right, who else has got something coming up that they want to share?
I'll share.
Go for it.
Sorry. The silence kills me sometimes. I'm not comfortable with it, but I just wanted to remind everybody, I'm Andy Hall. I'm the community outreach manager with Groups Recover Together. And just a reminder that we have in-person and also virtual opioid use disorder treatment. And so our members get 7 days of Suboxone, and they are required to attend a weekly group meeting. And we have care navigation to help with anything that may stand in the way of recovery. I put my contact information in there, and our referral line, which is 47, it's staffed by certified crisis counselors, so it's also a crisis line. So if you know anybody, no matter where they are in Tennessee, we're in 15 different states, so it's not just Tennessee, but across the whole state, we can help because we've got the virtual option as well. So just wanted a reminder, because I know the holidays can be tough. Anyways, I appreciate everybody being here today. It's nice to see everybody.
Thank you. I'm going to put an event that we have coming up in the chat. Our Youth Coalition wanted to do something just to kind of support mental health for folks around the holidays. And so next Wednesday at the Elizabeth and Carter County Library, we will have a whole bunch of different options for self-care. We have board members who are doing kind of art projects, youth who are doing art projects. We have chair massages, Reiki, all kinds of stuff. And so if y'all would help spread the word about that, it's just a drop-in event next Wednesday from 4 to 6. We'll also, of course, have mental health resources and some self-care resources there as well. But they just wanted to do something. They'll have activities for both parents, or for adults and kiddos. So if there are parents who just need a break for a second, there will be kids activities throughout the whole time through 4 to 6. And so parents can take a minute and just create a bath bomb or do some art journaling or whatever activity they want to do. And then their kiddos will also have some healthy coping stress activities, stress relief prevention, maybe activities. We're not stressing children out at this event. With some activities for their kiddos as well. So please help spread the word about that if y'all will share it and invite anybody who may be interested. All right. One last call for any upcoming events or activities before we get into our speaker.
Can I just say one more thing? I just wanted to let everybody know that we take all 10 care plans, and a couple Medicare. We have to run them if they're Medicare, and most of the private insurance or commercial insurance, and if they're self-pay, it's $65 a week. That does not cover their medication, but they can get, in a lot of pharmacies, they can just get their 7 days at a time. So I just wanted to throw that out there in case anybody wondered about insurance.
Thank you. One more thing that I thought of before we move on, Hale Community Ministries is doing a backpack donation at our South Hills office next Monday from 5 to 6. So if you know somebody who, I think we do a great job at the beginning of the school year at making sure our kiddos have the school supplies and backpacks that they need. And then sometimes we come back from Christmas break and we're still trying to make those supplies that we got back in August work. And so they're going to do a donation. Just as anybody that needs a backpack can come and get a donation of a backpack and school supplies on Monday at our South Hills office from 5 to 6. So if y'all know somebody that could use that, please send them our way. Anything else before we move on?
A quick question for Andy. Do y'all have any kind of grants or sliding scale for potential clients that financially just don't have the ability, even the 65, which is really good rate, but that don't have that. Do you have anything?
Unfortunately, we don't have grants, but we will work on a sliding scale. Definitely will do that. So in fact, I know that we've had some people that we've just covered until we could either get them insurance or whatever it may be, that for however many months it may be. So they'll definitely work with people. And if you need help, contact me directly and I'll help it work that angle for you as well. But yeah, they definitely will. There are I guess he's our chief financial officer. I was talking to him about it the other day, and he said he would rather see somebody get into recovery than not be able to because of financial barriers. So that's coming straight from the horse's mouth. So yeah, we'll definitely work with them.
Good deal. Thank you.
You're welcome.
All right, y'all. So I am super excited to have a lot of favorite health department employees, but these are two of my favorite health department employees who are going to share with us today about their programs. So I think we have Ella and Becky here with us, and I'll turn it over to you all.
So, hey, Jillian. Hey, everyone. Thank you for having us. Can you hear me okay?
We can.
Okay, great. Thank you. So my name is Ella, and I'm the CHANT team lead here in Carter, Johnson, and Washington counties. And this is Becky, and she is our newest member of our community outreach team, and I'm so happy to have her. And thank you for having us today. And I'm just going to tell you a little bit about Tennessee Department of Health's newest statewide initiative. And it is entitled Community Health Access Navigation in Tennessee, better known as CHANT. You want to go? Yes.
Oh, there we go. Huh? Yes.
No. Can you see the slide, Jillian?
No.
Nope.
Have you shared with us?
Okay. Let's share screen and see if that works for you.
It's saying disabled share.
Okay, try it one more time.
Okay. Okay, get that one out there.
There it is. Got it.
I'm sorry.
Okay.
Okay. So again, it is Community Health Access and Navigation in Tennessee, better known as CHANT. This initiative was implemented in the Northeast region back in July of 2019. It is a voluntary initiative, and it is designed to target families and or individuals who are eligible for and that are currently being served by one or more of our public health programs. And that would include TennCare Kids Outreach, Help Us Grow Successfully. Most of you know it as HUGS, Child Health and Development, Welcome Baby, and Children's Special Services. So basically what CHANT did is it streamlined the previously mentioned programs into one integrated model of care coordination so that the funding could be effectively and efficiently utilized to identify and address risk factors for the populations that we serve. So the vision of CHANT is to improve access to care by arranging for and providing screening, assessment, and navigation of preventative services, increasing awareness of the importance of primary prevention, including early periodic screening, diagnosis, and treatment, screening for social determinants of health and connecting to resources, and coordinating services for children and youth with special health care needs. So who is eligible to participate in CHANT? Any child ages birth to 21 years of age. prenatal and postpartum women to include adolescents, and children and youth with special health care needs, birth to 21, and that includes those with visual and hearing impairments. And Becky's going to give you a little bit of background on that a little bit later on. So our team is a multidisciplined team. We go out and engage specific individuals within the community. Those are those that are most likely to have poor health outcomes. We navigate their specific needs, whether it be medical or social, and then we measure the impact that we had. So I mentioned screening and assessment. Each member of the family unit is screened for the following, and that includes social service needs, mental behavioral health risks, child health and development milestones, special health care needs, medical risk, health insurance, medical and dental services. And depending on how the family unit answer questions on the screening and assessment, they have the potential to trigger 18 to 20 pathways of care. And I've taken the liberty to list a few. So we've already talked about behavioral health. They can have assistance with housing, immunization, screening and referral, maternal loss, perinatal loss, safe sleep, smoking cessation. If the family is interested in working on employment, family planning, health insurance, that is what we're here to guide them in that direction so that they can get the coverage that they need. Now, again, earlier, I did say it's voluntary. So if a family triggers 18 to 20 of these pathways and they only choose to do one pathway, then that is the pathway that we're going to work on with the family. Later on, if we're in the home with the family and something comes up, if we're working on developmental milestones with the child, and during one of our monthly conversations or home visits with the family, the mom indicates that she is now expecting. So we would make a prenatal and emergent need, and then we would start working with her on that pathway. So it is up to the family as to what pathway they want to work on. So I'll put together some of the caseload data that we have had since its existence in July of 2019. So from July 2019 to November 2022, Carter County received and were assigned 492 referrals. Currently, we have 2 full-time care coordinators, and between them, they have a caseload of 65 cases. Again, they do contact these families each month via home visiting, office visit, or via telephone. If the family doesn't want us to come to the home, then we don't go to the home. We're able to agree on a mutually agreed upon location. We currently have 2 referrals pending, or 2 families in pending enrollment. And you will see that we have completed or partially completed offered pathways, 138 families. We've had 7 families move out of the region. If they moved to another county or region within the state, then we do a warm handoff, and we will contact the medical service lead or the team lead to let them know that this family is relocating into their specific county and that they are interested in continuing services. The family screened, but they declined participation. So that stems back from Welcome Baby, and I'm not sure if any of you are familiar with it. That was implemented back in 2015 or 16, and Johnson County was the only county identified to participate in that initiative. And I believe that was because of the high infant mortality rates. So since then, it has broadened, and instead of calling people only high risk, the call center calls each family that they get a list of names of each family who have had a recent birth. And so they contact them to offer them services. And that stems from the Bureau of TennCare. We have 59 families that declined a screen assessment. 46 wanted information only, and then 118 of them were never successfully contacted. And when I say that they were never successfully contacted, that means that we have in this office attempted 3 phone call attempts. We have sent them a letter saying that we have been trying to reach you to offer you an exciting program. And then we go out and do an attempted home visit. And sometimes they're there and sometimes they're not. But then later on down the road, we will get a referral from many of our community partners, such as Frontier Health, Johnson City Medical Center, DCS, and it will have updated contact information and address. So we're able to reach them somewhere down the road a little bit later on. So at this point, I am going to let Becky go over our Children's Special Services program. And then if you have any questions for us, we'll be here to answer them for you.
Okay, so the Children's Special Services is part of that, the Title V program for the children and youth with special healthcare needs. So the CSS provides access to the comprehensive medical care for children with physical disabilities, birth to age 21. So children and youth will be screened for special needs with a quick survey. There's about 5 questions, and at least 1 question must be answered yes in 3 parts to qualify for the program. Any family may qualify for CHANT. So if there's a diagnosis that CSS can't cover, like autism, then we can still help with additional resources. They may not know about our care coordination, so we can help them with additional resources, so that's not, it's not that they're just not going to receive any resources. The family must meet the income guidelines unless the participant has a qualifying TennCare code that we can use. So then we will determine that they automatically qualify. Additionally, if they're in the families or the participants are adjunctively eligible, like for SNAP or WIC or Families First, then they're determined to be financially eligible for CSS also. The family's adjusted gross income must be below or at 225% of the federal poverty level. Eligibility is based on the family size and the income level. If the family's over income, though, we can prove income by completing a spend down with medical bills to get them under the income level. So just go ahead and refer, even if you think they might be over, go ahead and refer to the program and let us determine if we can, get them under the income guidelines. Children must have a chronic physical, developmental, behavioral, or emotional condition that also requires a health-related services beyond of a child generally. So again, like autism on its own will not qualify currently. Mental, emotional, or behavioral disorders, intellectual or developmental disabilities do not qualify. It must be related to a physical diagnosis. There are over 300 diagnoses, and I definitely do not know all of them. So they can range from GERD to heart conditions. NAS does qualify, but that's only covered up to age 3. So there's varying degrees of that. But again, we can, determine that with the referral. Dental is limited to like craniofacial diagnoses, conditions, and designated cardiac conditions. Several oral surgeries may qualify as well. So there's varying degrees of that also. One thing I'd like to note is, and this has been allowed in the past, but there's been a recent change and there are no more food orders for celiac disease. So it was allowed in the past. There's been a little bit of a budget change. So I know people have thought of that in the past, as part of the program, but just wanted to note that It's not allowed currently. And also, this has been noted in the past that CSS can pay for formula, but we really just do that if it's related to the participant's diagnosis. So there's specific reasons special formula can be, as you can see, can be allowed, but it really has to be related to their diagnosis. CSS is really care coordination. So, hang on. CSS is mostly related to care coordination, meaning that CSS can assist with difficulty getting TennCare to pay for like durable medical equipment through their MCOs. So the CS program may be able to pay when there's a gap between like their insurance deductible and what the insurance is covering. So the medical bills can be submitted through our medical service lead, and then we can determine if CSS can help pay the difference. So that's a good resource right there for them. And then the referral process. So that's a little bit different. It has changed a little bit. Transitioning from paper to electronic. That being said, you can still submit the paper. So we will still accept the paper. This is just a slight change to our new process. We'll share all that information with you. And now we're here. Any questions? Okay.
So we just want to say thank you once again for having us on here so that we can share a little bit about the statewide initiative. And here's our contact information. And again, as Becky said, we still do accept paper referrals. You can email any of us and you can call us up on the telephone. But central office does request and want us to have those referrals sent to the electronic form as a means to capture the amount of referrals that are coming in statewide versus region to region to region. So if you have no questions, we thank you very much.
Anything else, Ella and Becky, before we move on? All right, thanks y'all for being here and sharing about your program.
Cool beans.
Thank you for having us.
All right, before we move into our committees, does anybody else have anything they want to share? Okay, so I am going to put a link to the CCC website in the chat. This is something that Committee C has been working on for a while. But if you have folks who are interested in joining CCC, this is a very basic start of a page. But we do at least now have a starting place for the CCC to have a little website of their own. So it's cartercountydrugprevention.org/CCC. And if you go there, you can see it has contact information for our entire executive committee, the goals, the bylaws, the strategic plan, data that will continue to be updated and changed by Committee C, our meeting minutes, the membership form, and then also the recordings of all the meetings that we have had so far. So again, this is a work in progress, but I did want to share before we go into our groups and we lose some folks that this is a resource for you all to share with new folks who may be interested, or if you hear something amazing in a meeting and you want to share it with somebody, we do have this place now where you can find the recordings, find the minutes, find all the things, as well as our contact information. So it's all there for you. All right, so I'm going to go ahead and open up our committee rooms. Committee chairs is 1 o'clock. Okay, is that enough time? Do y'all need more?
That's okay.
Okay, well, I'm gonna go ahead and open these rooms. So our first committee is the Substance Abuse Committee with Tia. The second room is our Action and Awareness Committee, which is normally with Brittany. And then the third room is our Data and Assessment Committee with Emily. So I'm gonna open those now.
Hey, this is Tia. So Committee A is working on, we're still in the progress of working on an event kind of that we're going to get in connection with some of the churches in Carter County. And we're looking at more rural churches like up in Stony Creek and Johnson County to be able to offer them Narcan training and information kind of brought into them of what Narcan is, so on and so forth. So we're still in the process working in that, and so we'll have more updates coming later.
Thank you. I will share Committee B. We have been, I'll say we, this is Brittany's subcommittee. Normally, I just was being a helper today and filling in. They just had a really successful coffee and conversations event at the library. And so I think they're going to continue that maybe once a month or something. This month, we invited them to just be part of our event next Wednesday at the library and share resources there because December is so wild for everybody. And then they will continue offering those events after that. So they're doing awesome things, had a very successful coffee and conversations event. They had a panel at that event that seemed to be really successful of folks just sharing their recovery stories. And it seemed like it was a great day for everybody. So they're doing awesome things. Committee C, y'all want to share an update?
Well, we're happy, like we finally got our spot on the website. So we were looking at our website and talking about how we want to build it up a little more and what we can do to help us the best. We talked about our data and resources and preparing for the community health assessment next year, how we as a data committee can compare with some secondary data so that we can really be prepared to pick our main topics and look over time at our data trends on our main things we focus on next year. And then we just continued. We didn't get there, but we're also wanting to do, with our branding, some brochures and things like that, that you like the logo you've already put on the website. So we're just still working on all those things.
Thank you. All right, anything else before we finish? All right, friends, we will see you next month.